today we are going to see the Parkinson's disease. This Parkinson's disease is otherwise known as hypokinetic rigid syndrome. Okay, so what is rigid syndrome? Rigid syndrome is nothing but the parts of the body, like arms and legs, it will be going for the rigidity. Okay, so this Parkinson's is mainly concentrated on only one thing, that is dopamine secretion in the brain. Okay, so if the dopamine level is getting down, this Parkinson's will be going for the patients. So which kind of people they will be affecting in this category? Approximately you can see the age groups of 50 to 65 people age will be going for the Parkinson's disease. Now, who discovered this Parkinson? Dr. James Parkinson, a British physician. Okay, so he discovered this condition as Parkinson, so that he kept the name as Parkinsonism. Understood? Now, this Parkinsonism in local language will be telling us shaking palsy. Okay, so what is shaking palsy? The patient is affected with this Parkinson's. How they will walk? How they will walk? They will be having shivering, tremor, short steps, hesitating gait, stoop posture. Okay, so this will be the total thing for the what? Parkinson patient. Understood? So these are the basic things, and he discovered in the year 1817. Okay, and hence he named as Parkinsonism disease. Now, this Parkinsonism will be having certain things. What are the things? 65% cases will be having the classical Parkinsonism disease. 18% they will be having the drug-induced Parkinson's, and 7% they will be having vascular Parkinsonism. These things we will be learning in the later chapters. Okay, so among 100%, these things are classified. Clear? Now going for the causes. The primary Parkinson's. Okay, the causes is idiopathy. What is idiopathy? Unknown. Okay, most of the cases in the neurological terms it is idiopathic only. Okay, so in this factor Parkinson's is also coming out. First, next one is vascular. Vascular is nothing but a multi-infract disease. What is multi-infract disease? What is infract? So where can we see these infract patients? Stroke, yes or no? In stroke patients, we can see this infract. If a stroke patient is having multiple infracts in the brain, they will be going for what? Parkinson's. A recent study, research was developed. Okay, so what is their development is the patient is having a chronic infract. Okay, a chronic infract for ages, years. The patient will be going for Parkinson's. So what will be their first category is rigidity. Normally in stroke patients we will be having rigidity. Yes or no? In some cases we will be having flaccidity. These types of cases they will not be going for what? Parkinson's. For people who are having rigidity, they are most common to Parkinson's. Understood? Clear? If the people is having more rigidity and if they are not doing the regular physiotherapeutic exercises, that is the most common thing they will be going for Parkinson's. Understood? This is called vascular. Next one is called infection. So what are the infections it is going for? Commonly influenza virus. Okay? So influenza virus, it is most common thing that will cause the Parkinson's. Normally this type of influenza causing Parkinson is very less in India. Compared with other countries, in India it is very less. But we need to learn all these things. Next one is infection. Next one is toxicity. So what is toxicity? Due to certain chemicals. What are the chemicals? Read aloud. Okay, manganese and carbon disulfide, etc. What is extra? So there are many more things are there.